Good day, listeners. Welcome to DDM Health News Update today. On our program, Your Health, Your Wealth. Autism awareness is taking center stage as experts, caregivers, and stakeholders rally for a shift in perception and stronger policies to support individuals living with autism spectrum disorders in Africa. In a bid to change the long-standing misconceptions about autism, professionals have called for a united front to drive awareness and ensure inclusive policies for special needs individuals, particularly those on the autism spectrum. Speaking at the Autism Awareness Conference organized by the Bethel Zafe Autism Foundation, an international behavioral analyst, Mrs. Solape Azazi, emphasized the need for early detection, policy support, and public enlightenment to tackle the myths surrounding autism. She noted that contrary to popular cultural beliefs, autism is not caused by supernatural forces or affliction, but is a neurodevelopmental condition that requires early intervention and support. Well, according to the World Health Organization, that is the WHO, autism is a brain-related condition that affects 1 in 100 children globally, with signs often appearing in early childhood, but sometimes going undiagnosed until much later. According to Axis, workers play a crucial role in early diagnosis, recommending that screening for autism should be integrated into immunization routines to facilitate quick identification and intervention. If our healthcare workers are well trained, they will be able to dictate cases early and provide necessary interventions. Policies in our education system also need to promote inclusivity beyond physical structures. Learning materials must be tailored to support autistic children, Mrs. Axis stated. Also speaking at the conference, Dr. Oluwatosin Akinde, a specialist in special needs education, lamented that autism in Africa is still largely misunderstood, leading to stigmatization and poor support systems. She cited a 2021 study published in the Journal of Autism and Developmental Disorders, which revealed that over 60% of African parents first consult spiritual healers before seeking medical advice for autistic children. Akinde, however, who is also the founder of Bethel Zafe Autism Foundation, called for urgent action to break cultural stereotypes and foster acceptance. Many still believe that autism is a general cause or a spiritual attack leading to harmful practices such as spiritual purification or isolating affected individuals. No, it is not, because this myth must be dispelled with proper awareness and education. Rather, she urged governments, stakeholders, and caregivers to rise to the occasion and push for policies that ensure early diagnosis, educational accessibility, and social inclusion. It's time for Africa to redefine autism through awareness and acceptance, not exclusion. Every autistic child and adult deserves support, education, and empowerment, Akinde added. Meanwhile, the chairperson of the Nigeria Association of Women Journalists, that is the NEAWOJ, Lagos chapter, Dr. Adeola Akin, called a journalist to use their platform to drive autism awareness and push for inclusive policies. She stressed that media advocacy can play a crucial role in breaking cultural barriers and ensuring that autism is viewed from a medical and developmental perspectives rather than superstitions. Well, as experts push for better autism policies and awareness, the call is clear. Africa must move from exclusion to acceptance. Early diagnosis, education, and inclusivity must be prioritized to give every autistic child and adult a fighting chance in society. Up next, the Lagos State Tuberculosis and Leprosy Control Program Manager, Dr. Olusola Sokoya, has raised concerns over the difficulty in diagnosing tuberculosis in children, citing major challenges in obtaining reliable test samples. Speaking exclusively to media reports, Dr. Sokoya explained that unlike adults who can provide sputum samples for testing, children often cannot produce such samples, making diagnosis a complex process for diagnosing. According to the World Health Organization, that is the WHO, TB is one of the deadliest infectious diseases worldwide, with over 10 million new cases and about 1 million deaths recorded annually. Alarmingly, Nigeria bears the highest TB burden in Africa and ranks 6th among the 30 countries with the highest global cases. Reports indicate that in 2022, Africa accounted for about 1/3 of all TB cases in children aged from 0 to 15, with over 25% of TB-related deaths occurring in the region. Dr. Sokoya highlighted that while stool testing has been introduced as an alternative diagnostic method for children, the process has its own set of complications. The effectiveness of stool samples depends on being sent to a gene expert site without or within 3 hours of collections. However, due to transportation delays and logistical issues, many samples become unusable by the time they reach testing centers. The TB control experts also noted that stool tests have lower accuracy and specificity compared to sputum tests, making it even harder to get accurate results. Due to the difficulty in obtaining reliable samples, many healthcare workers have to rely on clinical diagnosis, which depends heavily on a physician's skill. Dr. Sokoye emphasized that diagnosing TB in children requires a high level of expertise, as symptoms like chronic cough may not always be obvious. He also noted that chest X-rays do not always present clear signs of TB, making it even more challenging to detect the disease early. Meanwhile, despite national efforts to improve TB detection in children, Lagos State has struggled to meet its targets on this. While the national goal for childhood TB diagnosis stands between 10 and 16%, Lagos has only managed to achieve rates of 4 to 5% annually. Dr. Sokoya stressed that beyond technical challenges, the lack of awareness is a major factor hindering progress in children. He warned that without increased public sensitization, many children with TB will remain undiagnosed, leading to severe complications and further spread of the disease within households. Addressing preventive measures, Dr. Sokoye revealed that the uptake of tuberculosis preventive therapy, that is the TPT, in Lagos remains lower than expected. TPT is designed to prevent TB in individuals who have been exposed to the disease, particularly in households with infected members. However, despite its importance, many at-risk individuals are yet to access the treatment. Therefore, he urged Lagos residents to take advantage of available TB preventive regimes, such as the 1-month daily treatment on the 3-month weekly regime, to curb the spread of TB. Therefore, in other words, taking TPT does not mean that you have tuberculosis. It simply prevents you from getting infected, just like taking anti-malaria drugs to prevent malaria. More people need to understand this, that TBT does not mean that you have tuberculosis. That means with TBT, you can be free from TB. With TB still posing a serious public health threat, experts are calling for stronger commitment increased investment, and better healthcare delivery as to achieve the goal of eradicating the disease. As the theme for this year's World TB Day states, "Yes, we can end TB. Commit, invest, and deliver." This is the TB theme of the 2025. Well, viewers, that's all for now on Your Health, Your Wealth. Stay tuned for more updates and do not forget to click on the like button, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more updates. I am Nenyere Michael Inezine. Thanks for watching.